Now, moving on from peripheral neuropathies, we are going on to our second section, that is the hereditary and metabolic neuropathies. Now, in this section, we will be going through different hereditary neuropathies, especially the disease called as Charcot-Marie-Tooth disease, because it's the most common hereditary neuropathy associated with congenital anomalies. Then in the metabolic, we'll be briefly going through the diabetic neuropathy, its pathogenesis, its mechanism, and how it affects it, what are its complications, and lastly, going through the another association problem called as alcoholic neuropathy, which is especially common in chronic alcoholism syndromes. So what are hereditary neuropathies? Neuropathies which may be present at birth. Usually there are four different types of neuropathy. One of them is hereditary sensory neuropathy. As the name suggests, it only affects the sensory portion of the nerves. There is insensitivity to pain and temperature. It could be autosomal dominant or recessive, and usually neuropathic joint disease or foot ulcerations. Because these children cannot sense anything, they may be resulting in a lot of foot ulcers because they may be exposed to different noxious stimuli, which eventually may damage their foot, but they are not aware of it because they cannot feel, their foot is insensitive to pain. The second disease includes hereditary motor and sensory neuropathy, which is also called as Charcot-Marie-Tooth disease. It's the most common form of congenital neuropathy. There's actually a mismatch of certain muscles which are weak due to neuropathy. The nerves are involved, and in other muscles which are normal, they actually pull the foot in different directions. It's actually a peroneal muscle, especially the peroneal brevis is weak and peroneus longus is strong, and there's associated weakness of tibialis anterior, and the tibialis posterior is working normally. So there are actually classical deformity which develops is because tibialis anterior and peroneus brevis is weak. They cannot, during the normal gait cycle, the foot is constantly be actually pulled in another direction by peroneus longus and tibialis posterior, resulting in a classical deformity called as cavo-varus foot, which is seen over here, which is resulting in a high arched foot. This is usually autosomal dominant. Type 1 is autosomal dominant, type 2 could be autosomal recessive as well as X-linked, but most common is autosomal dominant form. That the treatment is, it could be anything. It can be associated with spinal deformities as well, such as scoliosis, maybe associated with hip dysplasias as well. Depending upon what is the stage of disease, initially it's always physiotherapy, then maybe orthotics treatment could be advised for these cavo-varus deformities, but once the ankle foot orthosis or orthotic treatment fails, then the option is always associated with tendon transfers and calcaneal osteotomies. And if all these tendon transfer and calcaneal osteotomy fail, then the last resort is usually for this cavo-varus deformities, triple orthodesis. Now coming on to the others, this is another rare form of hereditary neuropathy called as hereditary neuropathy liability to pressure palsies. This is an autosomal dominant disorder. It's associated with multiple entrapment neuropathies. Usually, as it is multiple lesions, surgery is not the cure. The answer is actually physiotherapy and associated orthotics for the management in these children. Lastly, we're going through another type of hereditary neuropathy that is called as Friedreich's ataxia. It actually, there's due to chromosome 17 is defective, or there's duplication of chromosome 17. This results in peripheral PMP22 or peripheral myelin protein accumulation due to this abnormal frataxin gene. This may be causing the Friedreich's ataxia. It's a rare autosomal recessive disease associated with spinocerebellar dysfunction and degeneration. The classical symptoms are foot deformities, which may be cavo-varus or rigid cavo-varus deformities. They may be associated with scoliosis. The classical problem, it starts with children usually of 5 to 25 years of age, and problems is actually with as this cerebellar involvement, there is definitely irregular movements. They're unable to move, they are mobilized properly. Then there is definitely a problem with the motor functions as well, along with the dysarthria. So it's actually a complex disease involving musculoskeletal motor abnormalities along with the dysarthria. This usually dysarthria, painful muscle spasm, as I just told you, And the treatment, depending upon what kind of a problem it is, it may be associated with scoliosis as well. Usually, initial treatment is always with the physiotherapy, stretching of the muscles, and orthotics. But if eventually the disease is progressing, or if it progresses too much, as it may be, then maybe surgery may be required as well. But usually these children do not live beyond 50, because so this Friedreich ataxia is associated with cardiomyopathies as well. Rarely you see a Friedreich ataxic patient living beyond the age of 50 years. Coming to the metabolic neuropathies, as the word suggests, it's actually associated with metabolic syndromes. And the most common one of the rampant metabolic endocrine problem in the world is nowadays diabetes mellitus. And specifically, the diabetic neuropathy is very common in diabetics. These features include actually interference with axonal and Schwann cell function, because these myelin sheaths which are formed by the Schwann cell actually get degenerated. There is demyelination and axonal degeneration, as I just told you. There's vascular disturbances, because diabetes, it's a kind of a multi-organ dysfunction. There's a disease which involving multiple organs leading to neuropathy, vasculopathy, angiopathy, retinopathy, and nephropathy. So there is multiple level dysfunction at different organs are involved in diabetes mellitus. There may be insidious onset, usually glove and stocking type of onset is always there, and the patient classically presents with that I have now my hands were initially numb, but now I cannot feel below my elbow, as if it's progressing from distal toward the proximal point. There may be associated with muscle weakness and imbalance if it's involving higher areas. For example, different tracts which are coming down from the cerebellum may be involved as well. And there may be associated autonomic dysfunction as well, like hypotension and abnormal sphincter control. If you see, this is how it is actually happening. This is a nerve which is actually being even a simple nerve is also supplied with some degree of blood supply. But as the angiopathy as well as neuropathy in diabetes, so there is not only poor blood supply but also associated with degeneration of myelin sheath. So it's a kind of a vicious cycle, that there's degeneration of myelin sheath, which also help kind of complicates problem for nerve first, and then there is associated loss of blood supply to them as well, even further complicating the problems for the nerves. Now coming to the another form of neuropathy, which is mostly common associated with chronic alcohol syndrome, or those patients who usually are so much dependent in alcohol toxicity. This consumption of alcohol, too much consumption may eventually lead to axonal degeneration, which actually results due to the major cause is the nutritional deficiency. In these patients who are consuming alcohol too much, this usually results in a vitamin B1 deficiency called as thiamine. And this thiamine is actually normally required for normal function and growth of the neurons. Symptoms include paresthesias, as that would be with any nerve, weakness in feet and legs. There may be hyporeflexia, or decrease in reflexes, and there may be urinary difficulty and impotence. If it involves the genitourinary nerves, especially the pudendal nerve, this may be associated with the impotence as well, or erectile dysfunction as well. The problem, as we know, it's basically the alcohol, which is the underlying problem. Therefore, that has to be addressed. Now, it does not involve a single diabetologist or some other specialist, but it involves multiple other multidisciplinary team is required. Actually, for example, there has to be some person from the rehab as well, so that the patient can be rehabilitated back to his normal life. The treatment is nutritional supplements, that is, we give thiamine so that the thiamine deficiency is reduced. Then protection from the trauma, because alcoholics are more prone to getting trauma and getting different other types of nerve injuries and fractures. And then to deal with the alcohol abuse. Alcohol abuse has to be dealt with, because that is the primary pathology in case of the alcoholic neuropathy. Now, in the section from coming on from the peripheral neuropathy to the metabolic neuropathy, we have just covered and different types of neuropathy, especially a most common congenital neuropathy called as Charcot-Marie-Tooth disease, or classically called as hereditary motor and sensory neuropathy. And with these classical congenital neuropathies, they usually present with multiple other disorders. There may be spine problems, there may be foot deformities, there may be hip dysplasias, there may be motor problems as well as in case of hereditary ataxia. The treatment is usually initiated in the form of physiotherapy and stretching exercises. Then we move on to orthotics, and then we may have to go for some kind of a surgery and tendon transfers to deal with these kind of abnormalities. We have briefly discussed the diabetic neuropathy, its signs and symptoms as well, and alcoholic neuropathy as well. Diabetes, unfortunately, is rampant now, and it's actually it affects the multiple other systems. Like it affects the nerves, it affects the renal areas, it affects nervous system, it affects vessels. Therefore, unfortunately, diabetics are associated with polyneuropathy called as gloves and stocking neuropathy. That's all from the section. Thank you very much.